Now let's talk about other antihypertensive drugs. So we have renin inhibitors. So an example of that is eliscurin, and this is not really commonly used, and that's why I'm not gonna really talk about it much, but just so you know, in case you see it, it is used for hypertension as well. Another medication that is also used for hypertension and also used for other purposes are your loop diuretics. An example of those medications include furosemide. So furosemide is a diuretic, so it means that it makes the patient go pee or urinate. And so it works by basically getting rid of the potassium and as well as fluid, so which then will decrease blood pressure. Now we have to make sure that we check our potassium levels, right? Because we know that it decreases the potassium level. We also need to check our patient's blood pressure as well as their kidney function. Again, it is a diuretic, therefore it works within the kidneys. So you have to make sure that you have a good functioning kidneys. And so if you have somebody who's already having an impaired kidney function, you may want to be very cautious when administering it. And if it's severe or somebody is already in renal failure, this may be contraindicated for this patient. So, but again, loop diuretics is very useful for hypertension. Fluid overload is also used for heart failure, and it's also used for, in some cases, when a patient has really high potassium levels, because this gets rid of the potassium through the urine. Another type of medication used for hypertension or high blood pressure are your thiazide diuretics. An example of your thiazide diuretics include your hydrochlorothiazide. So for hydrochlorothiazide, we need to make sure that we're checking our potassium, our sodium, and chloride. So again, this is another diuretic. It means that it makes the patient urinate. And so this specific one, it works by getting rid of sodium and occasionally some potassium, but mostly sodium as well as chloride. And so the effect of that is obviously decreased fluids within the vasculature, which causes a decrease in blood pressure. So again, because it works within the kidneys, we need to make sure that we're checking our potassium levels, our sodium levels, chloride, blood pressure, and the patient's kidney function. So how do we check for kidney function? Well, we want to check for our intake and output. So we want to make sure that the patient is actually urinating. And in addition to that, lab-wise, we need to check for our BUN and creatinine levels. Next medication, we're not going to really discuss this in much detail, but know that there are medication that does the opposite. So instead of decreasing the blood pressure, it increases the blood pressure. And so these are called antihypotensive drugs. So again, these are antihypotensive drugs, meaning they treat hypotension or low blood pressure by increasing the blood pressure. So a pharm class that is used for this purpose is your alpha-1 agonist. An example of this drug, which you may see in the clinical setting as well as in the outpatient setting, is proamotine or midodrine. So side effects, obviously, this can increase your blood pressure, so we need to be very careful. And so when we are going to administer this medication, we need to check our blood pressure first and make sure that it's not too high, because again, too high of a blood pressure can actually be damaging for your patient. So again, check your blood pressure before administering midodrine.